Why do those who struggle with mental health issues like depression and anxiety prefer to hide their symptoms from the public? We need to start talking more openly about the subject of mental health, which is one that is typically seen as taboo. But because of the stigma associated with them, many diseases continue to go undiagnosed when it comes to treatment. Dealing with mental illnesses alone might make someone feel more alone and miserable. In this video, we are going to talk about top 5 mental health disorders. Number 5. Bipolar disorder. Bipolar disorder, often known as manic depression, is a mental illness that is marked by abrupt changes in mood. Throughout their lifespan, people with this illness undergo alternating episodes of mania and depression. These individuals may experience depressed episodes during which they feel hopeless, empty, worn out, or withdraw, manic episodes during which they experience exuberance or overexcitement and may exhibit dangerous behaviors. According to one study, bipolar illness patients are incorrectly diagnosed 69% of the time, and 33% of them remain thus for 10 years or longer. This is because the majority of depressed individuals seek therapy, and as a result, they meet the diagnostic criteria for depression. This leads to frequent misdiagnosis of it as depression. In a similar vein, some people receive an inaccurate diagnosis of ADHD when they receive treatment while they are still manic. Number 4. Post-traumatic stress disorder. People who have experienced a traumatic event, such as abuse or assault, neglect, a disaster, or war, are those who are affected by post-traumatic stress disorder. One of the signs is hypervigilance, irritability, flashbacks, inability to fall or keep asleep, social exclusion, a decrease in enjoyment or interest in activities that one would typically find enjoyable. In the United States, 70% of adults will experience a traumatic event at some point in their lives, and up to 20% of those people will develop post-traumatic stress disorder. However, a large number of individuals are totally ignorant of this truth. It is frequently disregarded or mistaken for another disease, similar to bipolar disorder. The symptoms closely resemble those of conditions like anxiety, depression, ADHD, and/or bipolar disorder. Number 3. Borderline personality disorder. The primary symptom of borderline personality disorder is an inability to effectively manage one's feelings and emotions. People who suffer from borderline personality disorder may exhibit major mood symptoms or psychiatric symptoms, as well as serious behavioral symptoms, such as irritation or self-destructive behavior. Mood symptoms include things like rage, anxiety, and feelings of isolation, while psychological symptoms include things like a skewed view of oneself and narcissism. Those who seek help for their mental health but are instead given a diagnosis of another ailment frequently have a difficult time getting the correct therapy for their borderline personality disorder. These erroneous diagnoses frequently include post-traumatic stress disorder, depression, or ADHD. Number 2. Depression. Depression is a common mental health condition that is frequently misunderstood. Long-lasting feelings of melancholy, hopelessness, and worthlessness are among the signs of depression. Changes in appetite, energy levels, and sleeping habits may also occur in some persons. While occasionally feeling down is common, if these symptoms last more than 2 weeks, it could be a sign of a more serious issue. A disorder that affects a person's health, mood, and thoughts is clinical depression, often known as major depression. When you have clinical depression, your eating and sleeping habits may be altered. It has an impact on how you feel about both the people around you and on yourself. It has an effect on your ideas as well. Untreated depression may increase a person's propensity for risky actions, such as developing a drug or alcohol addiction. It can also ruin relationships, cause problems at work, and make it harder to recover from life-threatening illnesses. Number 1. Anxiety. Another prevalent mental health issue that is commonly misdiagnosed is anxiety. Numerous symptoms of anxiety might appear, such as persistent worry, complete avoidance of particular situations or activities, and physical manifestations like perspiration and pounding heartbeats. Similar to depression, anxiety can range from mild to severe, and if left untreated, it can have a negative effect on every aspect of a person's life. Anxiety disorders are the most prevalent category of mental health issues. Anxiety disorders affect more than 18% of the general population, according to statistics supplied by the Anxiety and Depression Association. Only 36% of those who have the condition, however, seek treatment. If you have any worries that you could have an anxiety disorder, speak with your doctor. Discuss the signs you're feeling or how it's affecting your life in general. What do you think of our video? Let me know in the comments section below. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button before you go. Thanks for watching.